Hello, this is Noah, and I'm going to be doing a video on subcutaneous injections. So first I'm going to check the physician's orders, and I'm going to see that the physician ordered for Mr. John Smith, born 1/2/1980, a dose of heparin, 1,000 units to be administered subcutaneously for 1 dose. So I'm going to verify in the MAR and with the patient's EHR that that is going to be the correct physician prescription, as well as the correct medication and dose, calculating the dose. So I'm going to need 1,000 units of heparin to be delivered subcutaneous. According to the MAR, I have 10,000 units of heparin per 10 mLs, and I need 1,000 units. So that means I'm going to need 1 ml in order to have 1,000 units. So I will then gather my supplies and go administer heparin to my patient. So first I'll open the Pyxis. I will find the heparin, the bottle labeled 10,000 units per 10 mLs. I will take that. I will grab some alcohol swabs. I will need a filler syringe and an injection syringe. And I will need a 3 cc or 3 milliliter syringe. Once I have gathered the appropriate supplies, I will then proceed to verify that I have heparin, 10,000 units per 10 ml. It's for Mr. John Smith. It's going to be delivered as prescribed by the physician. Verify my 6 rights of medication administration. So right patient, John Smith, right drug, which is heparin, 10,000 units per 10 mLs. The right dose is going to be 1,000 units, so I will need 1 milliliter. I will make sure it's the right time, which is good, and the right route, which will be subcutaneous. I will make sure I document it after I have spoken with the patient. I will take my supplies, and I will go see my patient. Hello, Mr. Smith. My name is Noah. I'm going to be your nurse today, okay? I'm going to provide Mr. Smith with some privacy and perform hand hygiene. Mr. Smith, can I verify your name and date of birth, please? John Smith, 1/2/1980. Thank you, sir. All right. As I said, I'm Noah. I'm your nurse. The doctor's ordered a dose of heparin to be given to you, so I'm going to go ahead and give you your dose of heparin here in a minute. Do you have any allergies that I should be aware of? No allergies? Okay, great. So this is going to be given subcutaneous, so it's going to be given in kind of the fattier tissue of either your abdomen or your thigh or your arm. And we're going to be giving you just a small dose of the medication. The heparin here is an anticoagulant, so it's designed to keep your blood from clotting, to prevent clots from forming anywhere throughout your tissue. Normal reactions include fever, chills, a little bit of bruising is to be expected. Some injection site reactions. If you happen to have any blood in your urine, if you start to notice severe bleeding coming from anywhere or lots of bruising, or if you feel any abdominal pain, if you have any shortness of breath, allergic reactions, anything like that, would you please let us know, and we will make sure we get that treated as quickly as possible. Okay, Mr. Smith, I'm going to go ahead and take a look at your abdomen. That's where I'm going to plan on injecting this. So I will perform some hand hygiene. I'll put on a fresh pair of gloves here. All right. Let me take a look at that belly, sir. Okay, pull up your shirt, make sure everything stays secure. All right. Inspecting your abdomen, I don't see any bruising or swelling. I don't see any marks or redness. I don't see any bleeding happening. It doesn't feel tender. Do you have any pain in your abdomen? No? Okay. I'm going to make sure I avoid at least 2 inches around your belly button there. So we're going to go over here, probably on the side closest to me. We'll inject pretty laterally over here. Okay, Mr. Jones? Or Mr. Smith? Alrighty. That looks good. I'm going to go ahead and prepare your medication, okay? I will get out the appropriate supplies. My heparin, 10,000 units per 10 mLs. Fill a syringe, and I'm going to need an injection needle and a regular syringe. Okay. I would normally grab a 3 milliliter syringe in order to withdraw 1 milliliter of solution, so that way I have enough space to relieve any air or anything that gets into my syringe that's not the medication, and also so I don't have to reach as far back on my syringe in order to inject it. All right, I'm going to go ahead and open my syringe. Maintain sterile technique. I'm going to hold off on opening my injection needle. For the heparin, I will use a 25 gauge needle. It will be 1 to 1.5 inches long, and then that should get into the subcutaneous tissue. And I'm going to use a fill needle to withdraw my heparin. I'm going to grab an alcohol wipe. Since this is a reused bottle of 10,000 units of heparin, I'm going to verify in his chart that he needs 1 dose of 1,000 units of heparin solution. This is a bottle with 10,000 units per 10 mLs, which means that I will need 1 milliliter of solution in order to get 1,000 units of heparin. I will clean the top of my bottle with an alcohol wipe. Let's try it. I will open my fill needle, making sure to use aseptic technique. I will put my fill needle in. I'm going to withdraw 1 mL of air into my syringe. 1 mL of air. Okay. I'm going to place this into my heparin vial. I'm going to invert and inject 1 mL of air into my vial. I'm going to withdraw 1 mL of heparin solution. I'm going to remove any air bubbles by tapping. While maintaining sterile technique. Make sure that I have 1 milliliter of solution, no air bubbles, and withdraw my syringe. Verify I have 1 milliliter of heparin solution, which will give me 1,000 units of heparin. I will remove my fill needle and I will dispose of it in a sharps container, and I will apply the appropriate injection needle, and I will go to my patient. Okay. Go to Mr. John Smith at the bedside. Here will be my bedside demonstration. All right. I now have my 1,000 units of heparinized solution. I will come into Mr. Smith's room. I will again examine his abdomen. I'll make sure that everything looks still appropriate. I will approach the site selected, which is the abdomen away from the umbilicus. I will clean the abdomen and the site, starting at the center, moving out 2 inches on either side. For the subcutaneous injection, I'll remove my protective cover. Making sure not to touch my injection site, I will pinch, and I will insert quickly syringe at a 45-degree angle to 90-degree angle. I will release, I will stabilize, and I will inject the solution slowly into my patient. Once I'm done, I will quickly remove the needle and hold pressure. Do not rub, especially since this is heparin, as that will cause more bleeding. I will not recap my needle, but I will dispose of it in a sharps container. And when I am finished, I'll make sure there's no bleeding. If there is any slight bleeding present, I will apply a Band-Aid. I will remove my gloves. I'll perform hand hygiene. And then I will document my procedure.